Hi everyone, welcome to our webinar today. My name is Emma Fursten-Kaufman. I'm a knowledge broker on the Youth Wellness Hubs Ontario team in Toronto as part of our provincial team. I'm really excited for this webinar today. I wanted to let you know, for those who aren't aware, this is the second part of a three-part webinar series that Youth Wellness Hubs Ontario is hosting. Our next one on youth peer support will be held next Tuesday. Next slide, please. Just before we get started, I wanted to go over some quick housekeeping where you can find information about the audio broadcast today. All participants are muted today, so I encourage you to post in the chat pod, which you can access either on the right side of your screen or via the little blue bubble in the bottom center of your screen. We encourage you to ask questions throughout the webinar, although we'll be reserving the responses till our Q&A period at the end. Just a note that if you are typing in the chat pod, I encourage you to direct your questions to all participants so that everyone in the webinar can see the questions. If you have any questions about technical stuff, feel free to direct those to me. I am referred to as the host in the chat pod. Some other quick things. This webinar will be recorded today, so the recording will be available afterwards on youthhubs.ca and will also be emailed out to all the participants. On the top right of your screen, you are actually able to control how you view the webinar today. So you have that option to hover over that little control panel if you want to change your view. And finally, we will have an evaluation survey that pops up on your screen at the end of the webinar. So I do encourage you to give us feedback if you have 2 minutes to spare. That really helps us out to know how we're doing and how we can improve. And with that, I would love to introduce Dr. Joanna Henderson, who is the Executive Director of Youth Wellness Hubs Ontario.
Annie, hello, bonjour everyone. Before I introduce the rest of our guests today, I would like to do a land acknowledgement. Throughout Youth Wellness Hubs Ontario, our team at Youth Wellness Hubs Ontario is committed to reconciliation and to honoring the land through the programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our practices. We will create new relationships and partnerships with First Nations, Inuit, Métis, Miigwech. I'm very pleased to be able to introduce you to a fabulous panel of speakers today, but apparently I'm going to do the objectives first. Sorry about that. And then I'll introduce you to our fabulous speakers. I'm also really thrilled and consider it a privilege to have people joining us on this lovely Friday afternoon to talk about some really important issues. So the webinar objectives today are to learn and discuss how Youth Wellness Hubs Ontario sites are addressing and partners are addressing youth equity issues and the social determinants of health, especially in the age of COVID-19. And our discussion will include discussion of technology, food security, income, and population-specific strategies as well. Okay, so here are my introductions. So I'm really thrilled today to have a fabulous panel with us. We have Jackie Frank, who is the manager of the Kenora Youth Wellness Hubs and uses she, her pronouns. Jackie holds a Bachelor of Applied Science from the University of Guelph. Chloe Medwachek is a youth advisor from the Kenora Hub and is going into grade 12 in September. Chloe uses she, her pronouns, and in her spare time coaches gymnastics. Julia Medwachek is a youth advisor also with the Kenora Hub and uses she, her pronouns. Julia just finished grade 7 and is a competitive swimmer. Amanda Pierce uses she, her pronouns and is the manager of community counseling programs at Luminous Community Services, formerly known as Skylark, and is a partner within the Central Toronto Youth Wellness Hub. Mahum Ahmed is the clinical outreach worker with Malton Neighborhood Services at Malton Youth Wellness Hub. Mahum uses she, her pronouns. And Tashana Tyndale uses she, her pronouns. She is the youth representative at the Malton Youth Wellness Hub. I'm going to start by telling you just a little bit about Youth Wellness Hubs Ontario. This is an initiative that's grounded in responding to major gaps in our system around youth access to services, mental health services, substance use services, but really thinking across all different kinds of services that would enhance young people's achievement of optimal outcomes. So it brings together in a one-stop shop model of care, mental health, substance use, primary care, employment education, other kinds of supports, peer support. It's co-created with young people, it's situated in the community, and really intended to be a center in the community where young people can easily go to get what they need to support their optimal development. Next slide. I wanted to, given our topic today, say a little bit about youth wellness hubs and equity and social determinants of health. There's a long history of perpetuating unfair and avoidable differences in people's social and economic conditions, quality of care, access to care, health outcomes, and experiences. And these conditions have existed for a long time, and they continue up to the present day. These inequities cannot be understood without knowing the full history and the present status of how they've been orchestrated, both passively, but importantly, actively, intentionally and unintentionally over hundreds of years on this land, and not the least of which colonization, of course, being a contributing factor. Taking a health equity approach means taking concrete action to reduce, reverse, and remove those inequities, unfair and avoidable differences in how people are treated. Not just describing the differences, and I think it's really important that we move far beyond recognizing and describing the differences we see to really taking very assertive action to address them. So a health equity approach includes planning intentionally for equity, because these differences have not and will not go away by chance. The goal is that young people across Ontario can attain their highest attainable level of health. A real commitment to equity requires prioritizing anti-racism work. I'd like to share that Youth Wellness Hubs Ontario leadership recognizes the need to take intentional and concrete action across our initiative to address racism. We believe it's important to be thoughtful in how we approach this, while recognizing the need to be action-oriented and to move forward in a timely fashion. Our initial steps include identifying the types of actions our teams can commit to across all levels of the initiative, and this will inform the generation of an action plan co-created with youth, family members, and service providers to remove, prevent, and mitigate racial inequities in the delivery of our services and in the outcomes of our initiative. We will be sharing a wider communication in the coming days once we finalize this plan that we will build collaboratively, and will ensure that all sites are well grounded in how to move forward with this plan in their own context. With that, we'll change to the next slide, where I can share with you the questions that our panelists today have been asked to address. So the first question we asked them to address are, what are examples of creative ways you've addressed young people's emerging needs related to equity and the social determinants of health? And we know that some of these will include thinking about access to technology, food, housing, employment, and other activities. Our second question is, what partnerships have been key? Our third question has been, how has this work been funded? Our next question was, what has been the response of youth to these initiatives, and what outcomes have you seen? And lastly, how have youth been involved in the design and delivery and how have they been compensated? With that, I'm going to turn it over to Jackie, Chloe, and Julia to tell us about what's been happening in Kenora. Thank you, everyone.
Awesome. Thank you so much, Joanna, for that introduction. So as said, I'm Jackie and I'm the manager of the Youth Wellness Hub here in Kenora. And then I have two advisors from our Youth Advisory Council with me today. Our Youth Advisory Council has been with us through the inception of our Youth Wellness Hub in Kenora, but they have played a really critical role in all of the initiatives that we've come up with through the pandemic. So Chloe and Julia are the two youth advisors that are with us today. So on the map that you see here, just before I get started, because I get this question all the time, anytime we're doing something across the province or the country, where is Kenora, Ontario? So if you just take a little look at the red pin in the Northwest region, and that's in Treaty 3 territory. So I'm not sure if you can quite see, there's a little circle around it. We're quite north, but as you see in the photo to the right, which was provided by one of our youth advisors, we're surrounded by beautiful lakes, land, and we're really grateful to reside on the Treaty 3 territory. And we'll go next slide, thank you. So today we're going to talk a little bit about, first and foremost, what did we hear from youth, families, and service providers at the beginning of the pandemic and now throughout, and how we responded to this feedback and the initiatives that we came up with, as well as how it is helping young people and families in our community. So to begin with, Chloe's going to share a little bit about some of the feedback that we heard at the beginning of the pandemic that kind of set us off to begin responding to our doors closing and to the virtual services.
Hi, my name is Chloe. What we heard at the beginning of the pandemic is that there is a lot of information being shared online on the news and stuff. And it was getting a little bit like no one really knew what the correct information was. So that was one of the things that we heard from youth. The second thing was we were hearing information about the pandemic. It just became a normal part of life, as in we heard about it, but it's become so normal that it's like, oh, coronavirus, oh yeah, that's still happening, kind of thing. And then some youth weren't sure if usual supports were available. So like at school, we had counselors, mental health nurses and stuff. And then when we went to the hub, they had counselors and we had a nurse there too. So no one really knew if that was still in place or how we could get those services back. So yeah.
Awesome. Thank you, Chloe, for sharing that. So we responded to this information that was shared by our Youth Advisory Council, as well as youth clients that we were working with, to create a youth help or navigation line where young people could call in and talk to a youth navigator that would help connect them with our hub services, but also provide information about the other services in our community that are available, as well as provincial and national services. So as Chloe explained, some young people, they're in school, they're seeing their school counselor, and they weren't quite sure how to connect with their counselor once school had closed. And they were able to call the Youth Hub line and get connected with their counselor with the support of a youth navigator to do some of that background work. And most importantly, this line has just been a friendly person for young people and family members to call and talk to. So it's been very critical. And sifting through, as Chloe said, all of the information that's floating around and can sometimes be difficult to navigate through. So as we developed the navigation line, which did provide critical support, we continued to engage with young people and heard other needs as well, which Julia is going to share a little bit about.
Hello everyone, I'm Julia, and a lot of youth have been feeling bored while isolating, so they've been needing things to do to keep busy and feel connected with others, and wanting to learn new things.
So when we heard this, this was again primarily from our Youth Advisory Council, as well as on our social media. We were seeing comments and hearing from young people that they were feeling bored or wanted to learn things from our service providers. So we initiated some daily online programming on both our social media channels, and this included a variety of things, and it still continues today, of activities, challenges, contests, recommendations. This was an idea from our youth advisory to do a recommendation Monday where we recommend a podcast or a Netflix series and so on. We were able to showcase our hub staff and some of our youth advisors so that our social media audience could get to know them better. And our Ask Kukum cultural programming, which I say is our most popular. We get quite a few views on this. We have a wonderful woman who we call our hub Kukum, or grandmother, who provides services and shares knowledge about a variety of different traditional teachings. And this includes doing drum making, beading, ribbon skirt making, and we've received a lot of great feedback from youth and families about this programming. And many others as well, including nutrition, trivia, photo challenges, and more.
So what we heard from youth when the pandemic began was feeling disconnected from friends and classmates, and this happens with a lot of us. Right when we were told that we were going on March break, the province announced that the schools will be closing down, and we didn't know that this was we would still be out of school till now. But as the weeks went on, people and children were feeling disconnected from all of their friends at school. So that was one thing. And then now, going into now, it has been getting a little bit better. I know restrictions have been lifted a little bit. Me and my sister have both seen some of our friends, so it's gotten a little better. I don't know about the people down in Toronto because there's a lot of cases down there, but and then wanting to connect and support one another was a really big thing that we wanted to do at the hub, was to be able to support one another during these difficult times. And as Jackie just said, we had a big list of stuff that we did to try to, keep in touch and make people feel a little better. And then we also wanting our friends to practice self-care. So just making sure everyone is staying healthy and happy during these difficult times.
So this was it was a large part of our discussions with our youth advisory, and we came to an idea about nominating young people to receive a self-care package or a gift package of a sort. So we came up with a list of items that we could put into a package and make that available for a young person to be nominated by either a friend, a peer, a classmate, a family member, whoever, to receive one of these gift packages in the mail. And so once we had this idea, we went to our local community foundation, the Kenora and Lake of the Woods Regional Community Foundation, who awarded us with a grant to be able to purchase items, put these packages together, and get them out to youth. So it was a really successful program. We had about 90 nominations, and for our community, that is quite a bit. So we put handwritten notes from loved ones. We had a lot of family members that nominated young people, grandmothers, cousins, and friends as well, and delivered these packages, which we got really great feedback on. And importantly, we also provided a handout about the Kenora Youth Wellness Hub and the services that we offer, so that if they were interested in connecting to contribute to that self-care, they can reach out to us to engage in one of our services. So while this was a successful program, we did take a look at, we had addresses, and we realized that youth within our surrounding First Nations weren't properly represented within this program. So what we did was we went and we found another grant, and we're currently working on putting together 300 more gift packages from the support of Creation, which is a funding program with the Canadian Roots Exchange, and they support youth-led Indigenous youth-led initiatives, and we are distributing those to 9 surrounding First Nations communities. So this next one is a really important program that was new to our site when the pandemic happened. And we heard from youth, families, and service providers that young people that do not have access to a phone or internet are unable to access services to reach out to support and to connect with their natural support systems. As all of us know, internet is crucial for staying up to date on pandemic-related public health information. So collectively, both locally as well as provincially, the Youth Wellness Hubs Ontario initiative brainstormed and came up with ideas to be able to distribute mobile devices and plans to young people. So I'll flip to the next slide. So we first started with a used phone donation program where we did a call out in our community for anyone that had a used phone that they were willing to donate that was in good condition to our hub to be able to purchase a SIM card and get it activated and distribute to young people who are in need of it. At the same time, the Youth Wellness Hubs Ontario initiative had been in contact with Bell and Rogers, who graciously donated new phones, including plans, to each of our sites. We also were able to access funding from Waihu to purchase minutes and phone chargers, which is some of the feedback that we got from our service providers and families and young people, was that some people had phones, but they were out of minutes or they didn't have chargers to be able to use them. And once we got all of these phones together, we focused on distributing first by connecting with service providers and then advertising to youth and families online, so that we knew that we were doing a widespread distribution. And we got a lot of great feedback from our service providers about how much it supported young people. And it also helped in developing relationships with some organizations in the community who provided services to youth, such as youth who are homeless, youth involved with human trafficking, justice involved youth, and others. And we quickly distributed about 19 phones, I would say, in about 2 weeks. So it was very successful, and we're still continuing to collect donated phones and get those out. One thing that was an idea from our service providers at our network table was to program the phones with Youth Wellness Hub, our phone number, our navigation line, as well as other relevant support and crisis line numbers, so that young people, when they received the phones, they had access to the service numbers that they might need.
Information about services at Kenora Youth Wellness Hub is being shared across the community. Youth and families have access to a helpline for relatable information. New connections with youth have been made through cell phone donation program, self-care packages, online programming, and the helpline. And most importantly, youth are connecting to their friends and families and service providers.
So that's all we have for our presentation. I will save asking for questions to the end, but I appreciate everyone listening. And if you're interested in learning more about the Kenora Youth Wellness Hub, I encourage you to like us on Facebook or follow us on Instagram.
Terrific. Thank you very much, Julia, Chloe, and Jackie. That was really terrific. And you definitely have, all of you have been an inspiration to Youth Wellness Hubs Ontario, coming to the table with great ideas that we've been able to share out. I'll look forward to discussion at the end, as you said. Now I'm going to turn it over to Amanda Pierce from our Central Toronto Youth Wellness Hub.
Hi, my name is Amanda. I hope you can all hear me. My pronouns are she and her. I'm the manager of the Toronto Central Youth Wellness Hub. Our wellness hub was a pre-existing site and we've been operational since July 2017, first as a youth can impact site and now as a youth wellness hub. The Central Toronto Youth Wellness Hub works with all youth, but prioritizes the needs of 2S LGBTQ plus youth and youth of color. And we work hard to ensure that all our staff are representative of those communities, as we believe it's essential to meeting the health equity needs of our youth. So during this time, we've been able to move the majority of our programming online. Our drop-in is offering 2 events daily. We have a Netflix party where the youth vote on which shows and movies they want to watch together. And then we have a variety of Zoom video chats. So we have a Maker Monday, a Toolkit Tuesday. We have D&D, which we call Here Be Dragons on Wednesday. And on Fridays, we have 2S LGBTQ plus programming. We also have 2 therapists that support these drop-in sessions on Tuesdays and Thursdays. Our walk-in we were able to move to phone in, and we have available therapists 5 days a week for a total of 33 hours. Not in addition to, but as part of this, we've also have 4 Black therapists that we have available that Black youth and families can request to speak to if they feel like it would be more comfortable for them to speak with a Black therapist. We're offering brief counseling of 6 to 8 sessions, and we've moved our 2 12-week DBT groups online as well. And so those programs are in partnership with Luminous Community Services, which is formerly Skylark. We're also offering our employment and education supports provided by Toronto Youth Partnership and Employment online. We have a peer support group and case management provided by Loft Community Services, which is also moved to online and phone. We have our Family Connections group, which is offered by Sash Bear, that they've moved to webinars. We have our youth and our nurse practitioner that's in partnership with Vibrant Healthcare Alliance, and our psychiatric care, which is in partnership with Sunnybrook and KMH, and everything's now being offered in phone or through video calls. In particular, today, I want to tell you about our food support program that we developed to meet the needs of our youth and family during the COVID-19 situation. Right now, it's our only non-virtual program. So in order to meet the health and nutritional needs of our community, we ended up partnering with an organization called Stepstones for Youth, which is an organization that supports youth in the child welfare system and those who have aged out of care. We have always received weekly food donations from Second Harvest, which we used in our daily drop-in programming. And so when we had to close down, we had a lot of food left over. So Second Harvest food mostly includes shelf-stable food, but we were missing out on access to fresh fruits and vegetables, milk, bread, eggs, and stuff like that. And when we started putting together food baskets with our Second Harvest donations, because we didn't want them to go to waste, our youth and families let us know that they would really like access to some of the fresher food items, because that's kind of what they were missing out on at this time. So then we were connected with Stepstones for Youth by our 2S LGBTQ provincial youth outreach worker. It turns out that Stepstones had money to purchase food for their youth, but they didn't have space to put food baskets together or staff to help support and coordinate pickups and deliveries. So we talked a lot and we decided that it would be like a perfect partnership for us. They could supply the fresh food options and we would be able to supply stable food items and the people power to put together the baskets and the space to do that, as well as the space to coordinate pickups and deliveries, because we were still able to access our drop-in space some days of the week. So we were able to support their youth and they were able to support ours. Our key partnerships for this program were Second Harvest, Stepstones for Youth and the Studio Drop-In through Luminous, which was formerly Skylark. In terms of funding, we did not require additional funding as we already had the staff hours covered. Our second harvest deliveries were already happening, and Stepstones had already had money set aside for this purpose. So far, the response has been very good. We've had about 60 pickups and deliveries so far, and I know that there's a delivery out right now as well. In terms of youth participation in the development and design of the program, unfortunately, we didn't have youth as part of the design and delivery of the program, but we did hear from youth that there was a need for more like fresh fruits and stuff and vegetables and all the non-shelf stable food stuff. So we did take their feedback in order to implement this programming. And in terms of delivery, we're unable to have them involved because of the health and safety standards we have to abide by in terms of putting the packages together and getting them out for delivery. But youth and their families have a say in how they're accessing the food, what foods get into their baskets, and if they want to pick up, if they want the food picked up or delivered to them. So that's kind of a little bit about our hub and the program that we started to meet the food security needs of our youth. We've been doing a lot of other work as well, some of which is similar to the Kenora hub, and I'm happy to share more about that. I think one of my favorite things about youth wellness hubs is that every site is so specific to the youth that they work with. So it's so interesting to hear how other people are doing things. So yeah, that's Central Toronto.
Terrific. Thank you very much, Amanda. And thanks for commenting on that. You know, our vision really is that across the province, we have hubs that have sort of core features that allow young people to identify that this is the place where they'll get a certain quality of care, some like values-based care, while at the same time, each hub is able to respond and adapt to the local context. So thank you for mentioning that and for noting it. Okay, we'll move on to our Malton site now. So Maham Ahmed and Tashana Tyndale are going to talk to us about what's been going on in Malton. Welcome.
All right. Thank you for having us here and allowing us to speak about some of the great work that's undergoing at Malton right now. I guess I want to start off by just thanking everyone that has been involved in this incredible process, right? Like the more, I am the clinical counselor at our agency and have been involved with this hub from kind of its liftoff, and getting to know the youth in that community as well as across Peel. I see how much of this is quite a need, and as someone who wasn't a youth too long ago, I wish I had this when I was a youth. Having said that, I will get into addressing some of these questions, but just to give you a bit of background and qualify my answers that might seem a bit shortcoming against, you know, these amazing other hubs that you just heard from. So Malton, we were under construction, right? And that was supposed to finish right at the end of March, and we were preparing for preliminary services to be offered. And of course, this whole COVID situation threw that a bit off track. So we never have even had a formal opening of the hub. So currently we are only offering, we did still do a soft launch, a virtual soft launch, and are offering some services that were 100% youth identified and led. And I guess I'll talk a little bit about some of those initiatives that we have going on. Similar to the first hub you heard from, we also were able to obtain some phone donations from Rogers, and get that out to our youth that either didn't have a cell phone or didn't have a SIM card, just so they would be able to access all of these great virtual, everything's happening over Zoom or the phone now. So it's great because they do have access. Some of my youth personally have gotten this phone, and I can definitely speak to the burden it has kind of eased for them, even if it is just to kind of, have that phone there to even call their friends and such. It has worked as a protective factor in many regards. Another cool initiative that we've had going on in regards to outreaching to youth, to even, again, let them know about this. And it kind of sucks because we lost all that momentum that we were building up in the office to open up the hub. It kind of dissipated. So we had to be creative with our outreach methods. So we have the pay for post Instagram where youth are able to post a hub outreach flyer on their Instagram for 24 hours and they get paid for that. And I'm happy to say that I think almost 90% of our calls have been because of that outreaching from our youth. So, they post on Instagram and get to all their followers, and the followers are then the ones that are calling us in for whatever kind of support they need. The latest kind of cool thing that we've developed is a drop-in space called Quarantine Corner. And that happens every Monday and Friday at a set time after school. And youth are able to kind of just drop in. It's led by the youth team. That's a part of the hub as well as our agency. And we talk about a variety of different things. So the first thing that we started off with, very mindfully so, was the Black Lives Matter movement and being able to kind of talk to the youth about what is systemic racism. I'm sure we're all on some sort of social media, and it's been a lot. Personally, it's been a lot to kind of be in this role and be seeing those things online. So we wanted to provide a safe space for kids to voice their opinions and start understanding some of these things happening. And that was also our way to kind of foster some sort of hope and appropriate movement within these kids, rather than it fostering as anger towards the justice system or policing, because we know that we need those systems. We need them to change, but we also need them. The most recent drop-in, I think that is worth mentioning, is there was, I'm sure all of you are nationwide aware of the recent police brutality shooting in which Mr. Ijaz Chaudhry lost his life. And it was a mental health call. And so that really, this happened right across from our agency. So the hub, the agency, has been very, very proactive in addressing the community needs there. And especially the hub, we did, last Friday, on Monday, our topic was supposed to be post-secondary education and pathways to that, but we completely threw that out the window, and we said, let's talk about what just happened, and gave youth a chance to kind of unpack their feelings. It was a lot. Our community deals with a lot at times. So it's, again, just to go back to how important these hubs are for providing support for these youth. So some of the not so serious things that we have going on, or not so pressing things going on, are the programs that we've rolled out. So again, we held town halls a couple months ago to kind of ask youth which one of the many services the hub will eventually offer are the most important and should be provided along with the soft launch. And that was mental health, employment, and housing, as well as primary care. So we are working with a variety of different agencies within the Peel region, including Our Place Peel. So they are providing our housing workers, and the housing workers are able to work with youth and address their pressing housing matters, as well as maybe more long-term matters. So I don't know about the different regions, but in Peel, the numbers are still quite high. So the shelters are only operating at half capacity, and most of them are, of course, at capacity. So Our Place Peel, in collaboration with us, has this incredible program where they're able to provide funds for a youth who may need it and put them up in a hotel or an Airbnb, and pretty much just do anything to make sure these youth are doing okay. The employment piece is provided every Monday and Wednesday as a drop-in, they just have to call in, I suppose. And they can receive any sort of employment help, from resumes to interview prep, connecting youth to, a paid opportunity where they those programs, and someone that's helped. We have an in-house worker that does that, a part of the youth outreach worker program. And then also we partner with the Center for Education and Training. And they're really quite excellent. Like they are the location to go to in Peel for all your kind of employment needs. So the healthcare piece, I'm really impressed with. We're working with Four Corners, and they have this lovely location in Malton. So ideally the pathway would be if they come into us, the worker would either be there or they could just go across the street and go into their office. But right now, with everything kind of also being online with the healthcare piece, the pathway looks like, so the youth are able to call into the hub, and we directly have a line connected to Four Corners, which is the healthcare center, right? And a nurse or a doctor is assigned that call, so they wouldn't have to wait. They could speak to the doctor or nurse right away. It's barrier-free. Youth coming through the hub are prioritized, so they're really kind of getting amazing care through that pathway. And so the clinical piece, that is something that I provide, and we provide a drop-in, again, just kind of call in on Mondays and Wednesdays as well. So I take care of that on the Wednesdays, and then on Mondays we have a worker from PCHS, which is Punjabi Community Health Services, and they actually provide, their worker is able to take care of concurrent disorders as well, which is not something that's something that I might be referring out for, but now it's great because we have, between the two of us, we can really address the youth needs depending on our expertise and cover a wider range that way. So that's been some of the partnerships that are currently key. Our list of partnerships are a lot more than that. It's just these are the names that I thought were worth mentioning at the moment because they're the ones that are really on the ground and helping us out. In terms of funding, this has been completely funded by the Ministry of Health through CAMH, through the project. Yeah, we're okay with the funding piece because, like I said, we've had the funding there for a little while and the renovations just finished, and now we have, COVID, so we're not spending the funds in certain places. So we're able to do some other fun things, like one of our quarantine corner sessions coming up is in regards to cooking. And so we're going to go in and youth can pre-register, and then we're going to go out and deliver them enough ingredients so that they could cook for like a family of 4 or so. So, it's nice to kind of take advantage of the situation in that way. So I will pass it on to Tashana. She is our youth representative, and I think she would be best to kind of talk to you guys about how the youth have responded to this initiative and any outcomes that she has seen from her perspective.
Hi everyone, I'm Tashana. So like Maham has already kind of touched on a little bit with the youth drop-ins that we're having currently right now, we are getting a lot of success with our drop-ins, being that we have not opened yet and we haven't had much traction for our hub. We are getting a lot of our youth engaged in these drop-ins, and this is happening because of our social media platforms. So we are getting youth from the youth advisory to help us in regards to like promotion and to let everyone know that we are providing mental health services, employment services, and we have these drop-ins available. With this happening, it allows the youth the opportunity to engage with each other, get to know the staff that will be working at the hub when we do open. And we also, before the hub actually, like the closure with the pandemic happened, we were getting a lot of pre-drop-ins before. We had swimming, we had personal fitness, things of that sort, which helped us gain some foot traffic and youth letting us know that we're there for them. The Youth Advisory Committee has been very good with promotion of social media. They've also helped with outreach. They've assisted us with the virtual launch of the mental health and employment services that we are offering, which are the Mondays and the Wednesdays. And because of all this, our social media platforms have actually gained a lot of following. We're getting a lot of reposts. And they've also helped with the virtual pathway. So before the pandemic happened, we had some youth on the Youth Advisory Committee come in where they were actually able to go through our pathways and see what that would look like, and give us their feedback on things that they thought would work or things that they thought could, you know, be tweaked a little bit, so that once the hub is officially open, we do have everything kind of more comfortable and laid out for them. And yeah, that's pretty much it.
Yeah, I think Tashana kind of included all the points there. And I do think that we're at time right now, so I will let Joanna move on to the next segment. Thank you.
Oh, that's terrific. Thank you so much. And I just, you know, I have tremendous respect for the context within which you had to operate just on the brink of launching the fuller piece and then needing to pivot. And you guys have done such a terrific job at being able to pivot and respond. And you know, your community has had a number of tragedies over the last 6 or 8 months or 12 months. So you know, tremendous respect to you and the youth who have also been supporting your work and co-creating with you. Okay, so we're going to move into our questions segment now. I saw one question in the chat box, but I'm not sure that I'm seeing all of them. Oh, okay, here we go. Thank you, Emma. Okay, so first question, can we donate old cell phones to Kenora? So this is coming from, so people know we've had 100 people, or when I checked, it was exactly 100 people. I'm not sure exactly how many are on right now, but people log into our webinar today, and one of those people asked, can we donate old cell phones to Kenora? So Jackie, Chloe, Julia,
Thanks, Joanna. That is very gracious of you to ask. I really appreciate that. I definitely would not say no to phones being donated because we will use them. I'm not sure where the best place would be to provide an address if you wanted to ship them wherever you're from or if you're in driving distance. But I also encourage anyone who is interested in donating old phones to look within your communities as well to see if there are other cell phone donation programs, because I've seen it come up across the province and other communities as well. So maybe locally it's a need. But does anyone have a, Joanna, do you have a thought on where I could, perfect, there we go. Feel free to contact info@youthhubs.ca and then we can get in touch and I can provide an address.
Perfect. Thank you. Our next question goes to each of our groups today. How are you supporting Indigenous youth on reserve, in remote and rural areas, and off reserve or in urban settings? So each of you will have a different perspective on that, given where you're located. Jackie, since I see your face still, do you want to say a little bit about the Kenora context, and then I'll turn it over to Malton and Central Toronto.
For sure. So I did touch on this a little bit in our presentation. So just to expand, our lead agency in Kenora for the Kenora Hub is an Indigenous organization that provides culturally relevant health and social services to 9 surrounding First Nations, and it is governed by chiefs of those communities. So we work really closely with community members in the First Nations to connect with youth and families, as well as the other programs within our organization. It's quite a large organization to provide services that are culturally relevant. The beauty of the Youth Wellness Hub model is that we partner with other programs within our lead agency, as well as other organizations. So KCA also has or Kenora Chiefs Advisory, my apologies, also has a youth council that is representative of 1 youth advisor from each of the 9 First Nations. So we've worked and collaborated with the Kenora Chiefs Advisory Youth Council as well, with things such as designing the space and program ideas.
Perfect, thank you. Maham and Tashana.
Thank you for the question. You know what? It's actually like the one area that we are still figuring out our pathway. We do know that Indigenous folks do live within the Peel community, and that is something that we have struggled to outreach to those and connect to those youth. But it is something that is kind of one of our target items, is to specifically connect with them, and also even invite them to come sit on our youth advisory committee and be a part of that process, just as all other pathways have been youth led. So yeah, it is something that we are still exploring. And like I said, we are a bit early in our outroll stages. So it is something we are keeping in mind.
Terrific. And Central Toronto? Amanda?
Yep. So I would say the same.
I can't see you, like your face disappeared off the panel. So I was like, I don't know.
I'm here. Yeah, I would agree. Like the same thing with Malton. Like that's the one area that we haven't done enough work in. We are in the process of partnering with an Indigenous youth organization right now. We had several meetings set up right leading into the quarantine. So kind of things got put on hold, but we've restarted our conversations. We've had a number of them. And I think we're in the next steps of actually starting to look at what programming would look like with those organizations. With that organization, sorry.
Thank you. Maybe we'll stick with you, Amanda, and then we'll work our way back through. The next question is, how are you supporting youth on the LGBTQ+ spectrum?
Yep. So as I said at the beginning, we serve all youth, but we prioritize the needs of 2S LGBTQ+ youth and youth of color. So in our hub, we have done a lot of various trainings at different levels around supporting the needs of youth around gender identity and sexual orientation. We have specific programming in our drop-in on Fridays. The first Friday of every month is for all 2S LGBTQ+ youth, and then all the other Fridays are for our younger population, 12 to 16. And of course, they can use the drop-in space at any time, but those nights are specific to those youth. We have a provincial youth outreach worker that we've connected with our hub, who's our 2S LGBTQ+ provincial youth outreach worker. So she does a lot of outreach and support and connecting and bridging services with our therapists and our nurse practitioner and psychiatrists. And our nurse practitioner and psychiatrists have also done a lot of training and work around supporting the needs of this population. And our nurse practitioner sits on Wednesdays on the trans, I forgot what it's called exactly, but it's a phone call across the province that any healthcare providers that support trans youth sits on in community of practice. So she sits on that, which has been really, really helpful because we actually have a lot of trans identified youth that use our services. We also have an individual and family therapist that specifically works with 2S LGBTQ+ youth, and we hired her like as a Skylark employee, but we've recently moved all of her role under Youth Wellness Hub, so that was great. And then yesterday we had our Pride Prom. We partnered with Soy, which is supporting our youth in Toronto, and we held our virtual Pride Prom. So we do lots of programming for that community, and yeah.
Terrific, thank you.
Thank you for the question again. So our primary way of addressing these youth needs are through our partnership with AYSP, which is Associated Youth Services Appeal. And they are so excellent with LGBTQ related issues and matters and support groups. And they provide a wide array from transitioning youth to support groups, counseling, housing pieces, all that kind of stuff they provide. And they are continuing to provide that on an online platform currently. As well, I will mention that the 4 services being offered currently, which is the clinical, employment, housing, and first, and healthcare we have workers in all 4 of those areas that are also trained to understand and provide service to that group of people from an appropriate lens.
Terrific. Before I move on to Jackie, Julia, and Chloe, I'm just going to ask another question to Maham regarding anti-Black racism and the impact on Black youth during the pandemic. How can allies and various sectors support Black youth now in the context of the resurgence of the Black Lives Matter movement and in the future? So I'll ask you, and then I'll move on to Jackie and circle back to Amanda if we have time. We just have a couple of more questions, a couple of more minutes.
Okay, so if I understand, the question was, how are we supporting youth during this time with the movement and all?
Or how can adult allies and across sectors support Black youth?
Okay.
And anti-Black racism?
Yeah, I think I heard another hub mention this as well, where they have a Black specific counselor, for example, to help that particular population now from, their own cultural perspective and all. And the same thing happens in Peel. We have many Black workers across different areas to provide that specific care. So I think connecting youth to their culture is so important, because that is something that traditionally been, not addressed, and we won't get into that. Adult allies and someone that does, I hopefully do consider myself to be an adult ally to especially Black youth, especially during this, whole different pandemic kind of going on. Just have those conversations and let them know that you're an ally from that perspective, and ask them their kind of experience with this, or their family experience, and allow them that space to come in and talk. That's been really important for us, is allowing those youth and youth from other cultures as well to get together and share their knowledge, and allow the youth to see that they can, because in Peel sometimes we can have a little bit of cliques, as I'm sure is other areas too, but cliques in terms of the culture groups, and then that kind of that in Moulton it does create some friction. So the very nice thing that's kind of come out from recent events is seeing different communities come together and support, and that's something that Moulton and the hub is really trying to capitalize off of by providing youth not only the language and the appropriate language to voice their opinions, because I understand the anger. Like if I was, a bit more personally impacted by any of these issues, I think I'd be out there, taking to the streets with a lot of anger. But as an adult ally, it's also our job to explain to them what systemic racism means and what colonial history means, and the systemic appropriate ways, and the importance of voting. So just kind of tuning in their fierceness and passion towards these issues into actual things that they could do and support. I hope that answers the question. Terrific,
thank you. Very interesting, very helpful. Jackie, so there's kind of these, and Chloe and Julia, 2 sort of questions out there. How are you supporting LGBTQ plus two-spirited youth? And also anti-Black racism.
Sure, thanks, Joanna. Chloe and Julia, if it's okay, I can start and then jump in wherever. I guess I'll start with the first question around supporting 2S LGBTQ plus youth. I can speak. Recently, we have we've had a partnership with a group called Space Kenora, which is a group that had been meeting weekly with youth, as well as who are 2S LGBTQ plus youth, as well as allies, and doing various types of programming. And we had a reach out from Space somewhat recently to collaborate and move Space's programming into the Youth Wellness Hub in Kenora. So once our doors reopen, that will be starting up, and we are so excited for that. The staff there at Space have a lot of experience working with 2S LGBTQ plus youth, and we're really excited to learn from them. And previously we've been consulting and working together on making the space LGBT friendly as well. So, and to the second question, I apologize, I'm speaking quickly as I realize there's not a lot of time. I'll just add that we very much stand with Youth Wellness Hubs Ontario Ontario and your comment, Joanna, about leadership supporting anti-racist practices in our work. And locally, we look to how that is affecting Black youth in our community, but as well as youth of color and Indigenous youth, and how all youth see themselves and how they're fitting into that conversation. So we're very interested in the action items and working with the backbone and carrying those out in our community.
Terrific. Nicely done. We're right at time, but I do want to take a couple of moments to thank everyone, to thank our panelists very much for taking the time to prepare for this, to share your experience, and for what I've really observed to be such a tremendous amount of responsivity and capacity to pivot and respond and adapt. That's just been tremendous, and to share your expertise here today, I really appreciate it. I especially appreciate our youth panelists who have joined us today and shared their experiences and their thoughts. Emma will be sharing an evaluation, so please look for that. We have an online community of practice that people are welcome to join. It's posted in the chat box. I want to thank Emma and Leah for organizing today, and of course to thank all of the audience members who logged in today. Emma, turn it over to you for any final administrative comments that might be needed.
Thanks so much, Joanna, for moderating today, and thank you again to all of our panelists and all of our attendees. On the slide you see in front of you, you can see the website for Youth Wellness Hubs Ontario. It's where you can go to see any more information about the sites that you've heard from today, as well as our other sites and our whole model of care. It's also where we'll be posting our recording of this webinar once it's available. We will also send it out to everyone who attended today. EENet Connect is the location of our online community of practice where you can go share resources, look for resources, ask questions, engage in discussion, and you can contact us at info@youthhubs.ca with any questions. You can also see that our website is available in French, so feel free to reach out to us in French as well. Thanks again, everyone.
Thank you, everyone.